Well, thank you, Mr. Chair and Ranking Member Murray, and Mr. Secretary, thank you so much for being here today. I'd like to ask Mr. Chair for unanimous consent for the entry into the record of a copy that 19 of us senators wrote to the President in October of 2017, asking that the President follow the recommendation of his opioid commission to give the Secretary of Health and Human Services the authority to negotiate the price of naloxone. And I don't need a response to it now, Mr. Secretary, but I would appreciate a response for the record on what steps the Department has taken to investigate this recommendation by the President's own commission, because as you know, naloxone prices have been skyrocketing, and it is definitely hampering our first responders with regard to the opioid crisis.
So ordered.
Thank you. Mr. Secretary, in November, Senator Durbin and I introduced a bill with a number of others in the Democratic caucus called the Drug Price Transparency and Communication Act to require, under the FDA's authority, that direct-to-consumer drug advertisements disclose the cost of the drug. In my view, this represents an important step towards transparency. And despite this administration's silence when the bill was introduced, I'm really glad you are now looking into this idea. But what authority do you think HHS and FDA have to require drug companies to disclose prices in direct-to-consumer ads? Don't you need Congress to give you this authority?
So it would certainly, I would always appreciate congressional authority to back me up on that, because I undoubtedly will be sued. But I believe, as part of the fair balance in ads, that I think it's an important piece of information that consumers are entitled to, along with cost benefit. I think it's part of the cost. Okay, so if your working group at the department determines that you can't do this administratively, will you commit to requesting such authority from Congress? Absolutely, and in fact, happy even concurrently to be working with Congress if Congress wanted to move forward on that.
All right, excellent.
Now,
so while disclosing prices in ads is important, in my view, there's also a much larger problem, and we talked a little bit about this last week when we had a phone call. The fact that we have direct-to-consumer drug ads to begin with, and that we give drug companies a big tax break for them, even though they increase costs that patients have to pay. To me, this is a basic fairness issue. We shouldn't be giving drug companies tax breaks on the billions of dollars they spend on advertising that hikes up costs for consumers while Americans struggle to afford the rising costs of life-saving medications. So if this administration is actually serious about addressing drug pricing, I'd encourage you and the whole administration to go even further on the direct-to-consumer issue and work with Congress on ending these outrageous tax breaks and, frankly, getting rid of these ads altogether. So I'd appreciate the chance to continue to discuss these issues with you. I will tell you that when I suggest to constituents that we don't have these drug ads to begin with, they are overwhelmingly in favor of it. I want to turn to a different topic now. This administration has released its blueprint, and it says it wants to lower prescription drug costs. As you and I have discussed, I don't think the blueprint accomplishes what it sets out to do. But not even a month after releasing the blueprint, the Trump administration told a federal court that it would not defend the provision in the Affordable Care Act that protects people with pre-existing conditions. This administration is frankly talking out of both sides of its mouth. If the ACA's pre-existing conditions protections disappear because the Trump administration is putting politics over people and refusing to defend these very popular provisions in the ACA, then many Americans who need health insurance won't be able to get it, meaning they won't have insurance to help them afford their medications. This, Mr. Secretary, is like some kind of sick joke. The administration is trying to pull the wool over the American people's eyes by paying lip service to affordable prescription drugs in their Doolittle blueprint, all while gutting protections for pre-existing conditions, which will obviously make drugs less affordable for patients who lose their coverage. Given that the ACA's pre-existing conditions protections are critical for consumers' access to affordable prescription drugs, yes or no, will you encourage the Trump administration to change its position and defend the pre-existing conditions protections in the Affordable Care Act?
So the position articulated by the Attorney General is a constitutional and legal position, not a policy position, but we share the view of working to ensure that individuals with pre-existing conditions can have access to affordable health insurance. The President has always shared that. We look forward to working with Congress under all circumstances towards achieving that.
The President should instruct his Attorney General and the Department of Justice to do what they are obligated to do, which is to defend the Affordable Care Act. By the way, provisions of which, such as this one, the American people overwhelmingly support. Finally, I will just add my concerns to those that Senator Murray expressed about the separation of children from their parents at our border. First of all, some of the folks whose children are being taken away from them are coming to our country to seek asylum. So your characterization of them all being here illegally is inaccurate, to say the least. I also
It's actually not. If you present at a legal border crossing with an asylum claim, you'll not be arrested and you will not have your child taken from you. These are individuals crossing illegally into our country and being arrested.
That is
That's
different than what some of us are understanding from firsthand reports on the border. Secondly, as a member of the Homeland Security Committee, I had the opportunity to talk to your department members, and am very concerned that they don't have any protocols for reaching out to states when they are sending these children who have been separated from their parents or arrive here without parents to different states. States have an entire child welfare organization set up. They have procedures, and they should be partners with all of you. It is very concerning that the department has not prioritized the welfare of these children the way it should, and we will continue to ask you to take much more aggressive action to ensure that that happens. Thank you, and I'm sorry for going over, Mr. Chair.
Thank you, Senator Hassan. Senator Isaacson.